Good afternoon, and welcome to this week's live update. I'm Chancellor Donde Plowman. I want to start today with an update on where we are with state and federal vaccine mandates and regulations. It's kind of confusing, so I'm going to walk through these for you. As you know, President Biden issued an executive order that requires employees of federal agencies and contractors to be vaccinated against COVID-19. And as a major research university, we have a large number of federal contracts and grants. We understand this executive order to apply to most of our campuses. The Tennessee General Assembly also recently passed legislation regarding COVID-19 restrictions. Among other measures, it prohibits state-funded institutions from requiring vaccines. But there is a state exemption process for institutions like ours that are at risk of losing federal funding for failing to have a vaccine requirement. Once the legislation, our state legislation, becomes law, we will file for an exemption that, if approved, will allow the campus to comply with the federal vaccine mandate for employees. So let me say that again. Once the legislation becomes law, and that hasn't happened yet, but once it does, we will file for an exemption that, if approved, will allow the campus to comply with the federal vaccine mandate, the executive order, for employees. Now, we are also monitoring the lawsuit filed last week by the Tennessee Attorney General, which is challenging the federal executive order. Last week, the federal government moved their deadline for vaccine compliance to January 4th. The previous deadline had been December 8th. As I shared a few weeks ago, we do have some data from the state on what percentage of our community is vaccinated. Faculty, our data says, are vaccinated at a rate of 77%. 73% of all of our staff are vaccinated. The number we have for students is 64%. And we believe the actual percentage of those in our community who are vaccinated to be much higher, especially among students, because these numbers that I just shared with you only reflect those who received their vaccination in Tennessee, and that's the source of our data. Let's talk about boosters for a second. I want to remind everyone who has already received their vaccine about the recommendations for boosters. The FDA and the CDC have now approved boosters for all 3 vaccines, most recently making recommendations for the Moderna and the Johnson & Johnson vaccines. So, who should get those boosters? For those who've already received a Moderna or a Pfizer vaccine series, the following groups are eligible for a booster shot 6 months or more after they complete the initial series. So let me say that again. For those who've already received either the Moderna or the Pfizer vaccine, the following groups for a booster 6 months or more after they complete the series. That's when you're eligible, 6 months or more after you complete the first 2 shots. So here's the group. People who are 65 years and older. Anybody age 18 and up who live in long-term care settings or who have an underlying medical condition or who work or live in high-risk settings. Now, for those who received the single-shot Johnson & Johnson vaccine, the booster dose is recommended for everyone 2 or more months after the initial vaccine. So let me say again, if you got the single shot J&J, the Johnson & Johnson vaccine, the booster is recommended for everyone 2 or more months after your first shot, first and only shot. Importantly, regulators have also approved mixing and matching manufacturers. They have approved mixing and matching manufacturers. So it means that no matter which vaccine you recently received initially, you can receive any of the 3 brands for your booster shot. So let me say that again. They have approved now mixing and matching the manufacturers. So if you got well, Moderna, you can take the Pfizer booster, that kind of thing. So any of the three. More than 4,500 people have received the Johnson & Johnson vaccine on our campus, and nearly all of them are now eligible for a booster shot. So if that is you, please reach out to the Student Health Center to schedule your booster. The Student Health Center offers the Moderna and the Johnson & Johnson, and all three manufacturers are widely available for free in the community. You can go to your local drugstore and get it. Let's talk about flu shots for a second. Now, as you're getting your booster, it's also the ideal time to get your flu vaccine. Much like last year, we want to minimize the impact on our local health system by keeping ourselves and others healthy. I got my flu shot not long ago, and I'm really encouraging everyone else to do the same thing. Like the COVID vaccine, the flu vaccine both protects you and others by slowing the spread of influenza. Students, faculty, and staff can get their flu shot at the Student Health Center pharmacy. No appointment is needed. Walk-ins are welcome Monday through Friday from 9 in the morning to 4 in the afternoon. So let me give you a bit of an update on COVID. The COVID cases on our campus, let's talk about that. I want to remind you, you can always find the latest data on our active COVID cases and those who have reached out to COVID support team on our website, which is utk.edu/coronavirus. We update this data daily. As of the end of the day yesterday, we have 31 active positive cases. 7 are employees and 24 are students. As we head into the winter months, it's really important that we remain vigilant. You remember from last year, the cold, dark winter gives rise to COVID as well. So let's really stay on top of it. You can find out more about COVID and the flu vaccines, what to do if you're sick, and how to access the COVID support form at the Student Health Center website. Again, studenthealth.utk.edu. This is all we have for today's update. And as a reminder, it's homecoming. I hope you will join us over the next few days for all the wonderful events we have planned. WNBA champion Candace Parker is going to be our grand marshal for the parade tomorrow. Can't wait to see her and all of you all there. Please continue to be smart, wear your mask indoors, get your vaccine, and please look out for one another. We'll be taking a break from the live update during the week of Thanksgiving, and we'll be back for the final live update of the semester on December 2nd. Have a great day, and let's go Vols.